Hashimoto's thyroiditis is named on the name of the scientist who discovered about this disease. Now, as I told you that this is also a type of autoimmune thyroiditis. Now, that means that your body is going to produce the autoantibodies that will bind to the surface of the thyroid gland receptors, or that will bind to the cells of the thyroid gland and cause the over secretion or under secretion of the hormone. Now, as I told you that it is an autoimmune disease, so the exact reason behind the disease is not known. However, it is thought that both the genetic factors and the environmental factors are going to play the role. Now, in most of the cases, the disease is running in the family and the genes are defected. And also there are some environmental factors that can be reason of the Hashimoto's thyroiditis. Now these environmental factors can be the stress, it can be the smoking, or it can be any other autoimmune disease or disease of immune system that can lead to the autoimmunity, and that can trigger your genetic defective genes to cause the disease. Now, moving on to the cause of to the major causes of the disease. As I told you, the first one is the genetic causes. There is any genetic defect that can lead to the disease. Then there are some environmental factors, and there are some diseases. Like the first one is the type 1 disease. Now, the type 1 disease, the type 1 diabetes. The type 1 diabetes, you know that it is due to either the decreased production of the insulin or due to the insulin resistance. You can say that either the pancreas is not producing enough amount of insulin, and it is insulin dependent diabetes mellitus. This is the other name of the type 1 diabetes. So this can also lead to the thyroiditis. Then Sjogren's syndrome. Now, Sjogren's syndrome is basically, or it is also an autoimmune disease that manifests the different vast manifestations, ranging from the symptoms of the mouth, eyes, legs, bones, and joints. But the most prominent features of Sjogren's syndromes are the dry mouth and the eyes-related symptoms, and the joint disease are most common one. Now, as it is an autoimmune disease, it can also trigger the Hashimoto's thyroiditis. Then vitiligo, that is basically the discoloration of the skin. Rheumatoid arthritis, again, rheumatoid arthritis can also be the autoimmune in region, and this can also cause the Hashimoto's thyroiditis. And then there can be autoimmune hepatitis, again, an autoimmune disease that can lead to Hashimoto's thyroiditis. That is also an autoimmune disease. Now, coming to the pathogenesis of the disease. Now, you know that what is the reason behind the disease. Now let's see that how keeping all of these reasons in mind, how the disease will progress. First of all, what happened that whenever there is any stimulus, or whenever there is an activation to the humoral immunity response, the CD4 helper T cells are activated. When these CD4 T cells are activated, they cause the B cell, they help the B cell and produce thyroid-specific autoantibodies, or they are going to induce the formation of CD8 T cells. Now, this is another type of the helper T cells whose main role is in the cytokine production, or lead to the death of the cell. Now, here, when the B cells produce the thyroid-specific autoantibodies and under the stimulus of the activated CD4 T cells, this leads to the identification of the different types of autoantibodies in the patient who is suffering from Hashimoto's thyroiditis. Now, on the basis of the presence of these autoantibodies, the disease can be detected in the patient through different tests that then manifest the presence of these antibodies in the patient. Like there can be the antimicrosomal antibody, antithyroglobulin antibody, antibody to TSH receptor, antibody to iodine transporter. Now here, if you recall the patient Richa, whose case we just discussed before this lecture, she was also presenting these antibodies in the serum. Like she was positive for the antimicrosomal autoantibody, and antithyroglobulin antibodies. So we can, from this, we can say that she might be suffering from Hashimoto's thyroiditis. Moving on, there is the antibody-dependent cytotoxicity that can lead to the destruction of the thyroid, parenchyma fibrosis, and the lymphoid infiltrate. The structure of the thyroid gland will be destroyed. That is actually the Hashimoto's thyroiditis. The antibodies are produced, they bind to the cells, and they cause destruction of the cells. Then in other side, there will be the cytotoxicity, that thyroid cell cytotoxicity due to these killer cells that are produced by the CD4 T cells. And also there can be the FOS or FOS-L mediated apoptosis of thyroid follicular cell. Now this FOS or FOS-L is basically the ligand protein that will mediate the apoptosis of thyroid follicular cell. Ultimately, there will be the death of the cells or destruction of the cells that will lead to the Hashimoto thyroiditis. Now here, what can happen that at first there can be a condition, there can be a situation where there is hyperthyroidism. Now this hyperthyroidism can be because of this part of pathogenesis. When there is only antibody production, then there may be an increase in the level of the thyroid hormone. But under the influence of these CD8 cells, or because of the cytotoxicity, the hypothyroidism prevail, and there is a destruction of the cells that lead to the suppression of the production of thyroid hormone and decrease the level of the thyroid hormone in the blood. So this is the most prominent phase of Hashimoto's thyroiditis. Now, you guys are familiar that papillary thyroid carcinoma shares some pathological features with hyperthyroidism, and they have some common features like the appearance of the colloid in the cells, but the columnar cells are same. The hyperplasia is there, but definitely there are some distinguishing features like the hyperchromatic nature of the nucleus in case of hyperthyroidism makes it distinguishing from the papillary thyroid carcinoma. Now here we are talking about the Hashimoto's thyroiditis, and basically we are going to see that what is the relationship between the Hashimoto's thyroiditis and the papillary thyroid carcinoma. Well, is there any relationship, and if there is, then what is the role of Hashimoto's thyroiditis in causing or in treating the papillary thyroid carcinoma? So let's start with the pathogenesis of papillary thyroid carcinoma to know that what is the link between these two types of the diseases of thyroid gland. So first of all, the reason behind the papillary thyroid carcinoma is genetic defects and the environmental background. Just like when we were studying about the Hashimoto's thyroiditis, there were both the genetic factor and the environmental factors, including the stress, including the smoking and other ways diseases were performing their role in causing the disease. So here, similarly, genetic background and environmental background, both things will cause the thyroid disease, or they will lead to known autoimmune thyroid failure first. Because of this known autoimmune thyroid failure, there will be increase in the TSH level that will lead to the symptoms of hyperthyroidism. And then there will, in order to cope up with this hyperthyroidism or the increased level of the thyroid hormone in the body, the compensatory mechanism will be activated. You know that when there is a high level of thyroid hormone in the blood, the negative feedback mechanism is activated, and the signal is sent to the hypothalamus, and then hypothalamus stops the production of TRH, then TSH, and the production of the thyroid hormone is stopped in this way. So the compensatory mechanism start and to cope up with this condition, but as there is the genetic defect and other reason behind the cause of the increased level of the thyroid hormone, then there will be the compensatory hyperplasia. The production of the thyroid hormone does not decreases, so the cells have to compensate this overactivity by increasing their size, by going into the hypertrophy. That's why it is called as the compensatory hyperplasia that results due to the hyperthyroidism. Then what happens that there is the expression of oncogenes, and this oncogene expression lead to the mutations in the gene, and these mutations then lead to the papillary thyroid carcinoma. First of all, there is the micropapillary thyroid carcinoma that later progress into invasive form, and in invasive form, then there is the accumulation of the lymphocytes in the tumoral tissue with development of immune responses. The cells or the immune cells goes on accumulating, and then there are changes in the immune responses that lead to the advanced papillary carcinoma. Now you can see that there are gradual changes, that some of them are due to the genetic background and some are due to the environmental reasons, like oncogene expressions, point mutations. These are the reasons that are mostly due to the environmental reasons. And also it is found through the studies that this oncogene expression and point mutation increases because of the Hashimoto's thyroiditis. If there are any other disease present there, like the Hashimoto's thyroiditis, it promotes the oncogene expression and point mutation. Now that may be because both have some autoimmune origin. There is the production of autoantibodies that can lead to the cause that can lead to the papillary thyroid carcinoma. Moreover, it is found that when the patients, mostly during the resection of the carcinoma, the Hashimoto's thyroiditis is found in the patient. So in almost 30% of the patient who are suffering from papillary thyroid carcinoma, they also suffer from the Hashimoto's thyroiditis. So we can say that Hashimoto's thyroiditis can progress or can facilitate the progression of the papillary thyroid carcinoma. And the reason behind is their pathology or their pathogenesis. So these it can lead to the papillary thyroid carcinoma. Also, we have discussed about the Hashimoto thyroiditis relationship with the Graves' disease when we were discussing about the hyperthyroidism. We discussed that how CD8 cells are also involved in the Graves' disease, but the difference between the CD8 cells of the Graves' disease and here in the Hashimoto's thyroiditis is that in the Hashimoto's thyroiditis, CD8 cells lead to the killing activity and kill the cell, cause the death of the cell, where there will be the hypothyroidism as a result. And in case of the Graves' disease, there is hyperthyroidism because the Graves' disease is prolonged because of the activity of CD8 cells. So this is just some studies about the relationship of the Hashimoto's thyroiditis with the papillary thyroid carcinoma and with the Graves' disease. Now moving on to clinical features. Now you know that there is any inflammatory cause or autoimmune cause that lead to the production of antibodies or that cause the inflammation and destruction of the cells. Now the cells are destroyed, then what are the different symptoms that patient will experience? The one, as I told you, that the patient will suffer from hypothyroidism. Now, that means that all the symptoms of the hypothyroidism may be present in the patient, like there can be the distress or the depression and changes in the eating behavior. There can be the diarrhea and constipation as well. However, the symptoms of the Hashimoto's thyroiditis are almost random and they are not specific. The patient may suffer from the fatigue, depression, fibromyalgia, that is the pain of the muscle fibers, and then diffuse thyroid enlargement and mild hyperthyroidism or hypothyroidism. Now, you can see that all of these symptoms are related to the hypothyroidism or hyperthyroidism, the fatigue, depression, fibromyalgia, and diffuse enlargement of the thyroid gland. They can be observed in case of hypothyroidism patient. And there can be the mild hyperthyroidism as well, as I told you, in the start of the disease or when there is just the production of autoantibodies. Now, here you can also relate the symptoms of the patient Rija that we just discussed before starting a lecture. She was also suffering from symptoms that are related to the Hashimoto's thyroiditis. Now, the symptoms are also confirming that the patient is suffering from Hashimoto's thyroiditis, and also the level of the hormone and the presence of autoantibodies is also confirming the diagnosis of the Richa that she is suffering from Hashimoto's thyroiditis. Now, if you look at the pathology or morphology of the thyroid gland, in case of Hashimoto's thyroiditis, this gland becomes swollen, the size is enlarged, and the gland also becomes thickened or coarse. The surface of the gland become nodular. As you can appreciate here in these diagrams that the gland is nodular, nodules appear, and the gland is also larger in size. Like normal is 35 gram, and in this case it is up to 200 gram in size. And if you look at the microscopic features of the Hashimoto's thyroiditis, here you can appreciate a lot of inflammatory infiltrate, like the plasma cells, B cells can be there, and other inflammatory cells can also be seen in the patient suffering from Hashimoto's thyroiditis. Moreover, there is the atrophy of the cell. The follicular cells die, and atrophy is more prominent in the patient suffering from Hashimoto's thyroiditis. A special type of the cells that are known as Aschen's cells, they are also seen in the patient who are suffering from this kind of the disease. They are basically the cells that are produced due to the atrophy of the follicular cells. So they can be appreciated in the Hashimoto's patient. So this was all about the Hashimoto's disease, its clinical features, and the presentation as well.